Thank you very much, Sue. And just to reiterate, I will be asking you to get involved in the session today. So if you can use the Q&A function to participate and interact in the session. But we're going to kick things off. As you can see, the session is entitled Predict to Prevent. So all about implementing a risk-based approach to psychological health and safety, why that matters, but also crucially, how we can achieve it. So before we get started on the main event, a quick, but I assure you very brief introduction into me as your presenter, but also Wellity Global, which I'm the proud co-founder of. So firstly, a bit of background about me. I've worked in the space of psychological health and safety and broadly work-related stress prevention for 14 years. I'm a professional member of the International Stress Management Association. I'm also a member of the Association of Business Psychologists and also the Fellowship of Associated Stress Consultants. I have various qualifications, including a master's degree with distinction in workplace health and wellbeing from the University of Nottingham. And for my dissertation, my research projects, I actually investigated the topic of work-related stress. And specifically when we've got self-reported scales and asking employees to rate levels of stress, really what comes to mind and how they really perceive the word stress. And is it something they think about recent events? Is it something they think about the last 6 months? Do they think about their emotions? Do they think about their work? But what essentially do they perceive the word work-related stress to mean when they're thinking about rating that? My work was published and presented at the European Occupational Health Psychology Conference. And really my focus in all that I do is being proactive and thinking about how we can address any causes of ill health related to our psychological state and our work at source, and how we can be really proactive in implementing measures that make a tangible and lasting difference. So these are all things I'm going to be exploring with you today. As you can see, I'm also the proud co-founder of Wellity Global. We work across the world with organisations across 80 countries to provide work-related training in relation to creating healthier and happier workplaces. Very proud to work with lots of different organisations in multiple industries, and really, as I say, make a difference at source. Now, I'm going to spend a bit of time talking about the call to action and why this matters so much, but I'm not going to spend a lot of time on it because, quite frankly, I'm fairly sure that that's why you're here today, because you understand the importance of taking this action and why this is so critical. Some of these statistics you may have come across recently, but they're really starting to delve into the importance of being really comprehensive in the way that we approach the topic of psychological health and safety. So quite a few figures here from the Deloitte report from 2022. Firstly, looking at the cost of staff turnover to poor mental health has increased by 150% in the last 3 years. We have, in relation to staff turnover and churn rate, we've got 28% of employers have either left or are planning to leave their jobs, with well, really 2/3 of them citing poor mental health as the reason they want to leave. We've also got the cost of poor mental health and the impact that's having on organisations, and that is increasing. UK workers are taking more sick days than at any point in the last decade. Research there from the CIPD. And this one particularly will go on to explore about why this is so important to be thinking about is workload and management style being cited as some of the top reasons for work-related stress, and really starting to think what we can do to circumnavigate that and to reduce the impact that is having on our workers. And also thinking about particularly management training. I'm really passionate about the importance of management training with this topic, but really exploring why that is so pivotal when we're looking at psychological health and safety. So organisations are more likely to train up mental health first aiders than managers to support mental ill health. So when we think about where we've gone to, thinking about the amount of time I've been in this industry, we've done a lot to raise the bar of awareness when it comes to mental health in the workplace, and understanding the importance of this topic. But we're still seeing rates about attendance, about turnover, about ill health, about work-related stress. They're still going up. So there's something really wrong with the way that we are approaching this topic, because it's really great that we're seeing such a drive in organizations backing this, understanding the moral case, the legal case, the business case. They're really getting behind thinking we need to do this and we need to do it well. But there's something amiss with the way that we're putting these pieces together, because we're still not seeing an impact where it matters, which is with our workers' mental health. So we're really starting to think about what we can do to tackle it in a way that does actually work and that does work at source. So this is really what we're hoping to equip you with the skills and the knowledge to achieve today, because we need to see a shift. We need to see a turn in stats like this. And I hugely believe, as we'll go on to look at, that managers play a really, really key role in this. And we've seen a lot of managers feeling like they're the squeezed middle. If you're on here and you're a manager, you're probably feeling, that you're quite familiar with that we've got the pressure from above to, hit targets, to perform. We've got the pressure from below, that duty of care to look after staff, make sure they're doing their job. And at the side, we've also got our own lives, own personal concerns, personal stresses, and it's a lot to navigate. And I personally think that there's a sense of overwhelm with managers and thinking about all the complexities of looking after the modern worker. And when we're thinking about the financial crisis, we're thinking about topics that have increased up the business agenda, such as neurodiversity. It's Neurodiversity Week. There's so many different things that managers feel that they should be experts in. And I think we need to get back down to drilling to the basics of work-related stresses and starting to think what managers can and can't affect when it comes to their workers' health and how we can best achieve this. Now, you would have seen the description of this session, the mention of the ISO, the standard in occupational health and safety management, psychological health and safety at work, which is very relevant to what we're talking about today. And really, this standard has two main aims, and it's looking at preventing work-related injury, but also promoting well-being at work, but looking more at an occupational health and safety management system. So that kind of framework where we look at this as a health and safety hazard rather than well-being, which is something that's nice to have and it's almost optional, but we look at this as a critical concern for our workers when it comes to their health and safety. And we look at it in exactly the same way we do with physical health and safety risks, and we're just as robust with the approach that we take. It is the child standard of the 45001, but it's all about this shift for me, that we're moving away from this narrative of thinking this is nice to have to something that is actually critical to our businesses and for our workers' health and safety. The point in bold there at the bottom is in bold for a reason, because I see a bit of blurred lines around psychological health and safety and psychological safety. They are very, very different things. There is some relationship and correlation between the two, but they are different. So psychological safety, you may have heard it attributed to the work of somebody called Amy Edmondson, Project Aristotle with Google. The concept of psychological safety actually dates back much further than Project Aristotle and Amy Edmondson. It goes back to 1965. But it's essentially creating an environment where people can take interpersonal risks, where they can show vulnerability, they're not afraid to fail, they can talk about concerns, they can demonstrate growth mindset. So it's, of course, really important for healthy working cultures. And if we have psychological safety, people will be more likely to air any concerns they have, such as work-related stresses, and it'll be easier for them to talk about. But psychological health and safety is all about this framework and a structured approach to how we manage something called psychosocial risks. Now, psychosocial risks, I just want to make sure we're establishing all the essential terms before we go any further with this. So I'm just making sure we're really clear on what exactly we are talking about. So psychosocial risks, really essentially it's a combination of the word psychological and social. So it's all about how we respond to our work, work design, workplace environment, working conditions, and essentially that relationship that we have with our work. And if these aren't managed effectively, they can lead to not just stress and mental ill health, but also physical harm. And essentially, it's all about managing these risks. As I said, exactly as we would do with physical health and safety, we need to think about the framework that we have in place and the system we have in place to manage these psychosocial hazards, and making sure that we're doing that in a systemic way. So when we refer to psychological health and safety, it's all about how we identify, but also address the hazards that are in place in our workplaces. Now, Sue did mention, and I did mention, there's a little bit of interaction here. It's nothing too complex or involved, so don't worry about that. But I would like to ask this question. So you can use the Q&A to answer with this one. Does anyone know what this is a picture of? I'm going to top up my water while we see if we get any replies. Bit different from talking about psychological health and safety, but does anyone know what this is a picture of? Ooh, we've got two straight out of the blocks. We've got two answers. I don't know if the room can see the responses coming through. Oh, we've got ACM lagging. That's very specific. So we've got asbestos, asbestos. So yeah, absolutely, you are correct that it is actually asbestos is a form of asbestos called chrysotile. So there's three main types of asbestos that you'd come across commercially that are used. Asbestos laggings, we've definitely got some people who know they're asbestos. So chrysotile is the most common. You also have amosite and crocidolite, and then there's three others that are a bit more rare. Chrysotile is the most common, as some of you clearly are familiar with. But you're probably thinking, what on earth am I talking about asbestos? Well, as well as my qualifications and experience when it comes to psychological health and safety, my very first job actually out of university was working in an asbestos laboratory. I'm a qualified asbestos analyst, and I actually wrote the quality management system to comply with the UKAS regulations and get UKAS accreditation. So I was the quality manager. So essentially, I understand inside out what managing the risks associated with handling asbestos entails, and how to write a robust quality management system to comply with the relevant legislations and ISOs, but also to make sure that we're minimizing any risk to health. So really starting to think about control measures, thinking about preventative actions, thinking about corrective actions, and really making sure that we're nailing down the fact that this could pose a risk to health, and we need to make sure that that risk is minimized in every way possible. The other reason there's a parallel here with what we're talking about is the thing is with asbestos is that exposure and the risk that causes to our health isn't something that happens instantly. It's something that can take a lot of time. So the thing is, when we see exposure to asbestos causing problems with people's health and causing illness, it can be years and years and years later that we're actually seeing that manifest. And there's a bit of a parallel there with particularly stress, because sometimes we just assume that our day-to-day working lives, they're stressful, they're high pressure, but we don't necessarily know the damage that it's causing until further down the line when it comes to our physical and mental health. So it's all about starting to think what we can do to manage the risks associated with ill health and be really, really proactive in the measures to do that. Now, in the interest of just making sure that we're clear on terminology, I have another question for you. So back to our Q&A. So we have here a scenario. We have a shark in the water and we have a person standing on the beach. Is the shark in the water a hazard or a risk? So back to the Q&A. Is this a hazard or a risk that we can see with the shark? Oh, Amit, straight out the blocks here. Hazard, 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 risk. Okay, so we've got a bit of a mixture. What does everyone think? So most are saying hazards here. I should have done a poll, shouldn't I? We could have seen the differences. So quite a few people are coming through and saying hazard. I think, yeah, majorities are coming through are hazard. Absolutely. And as Amit rightly says, when we have this situation, the shark itself in the water is a hazard, but it's only when we have the person going into the water that we're seeing a risk be presented. So it's really, really important that we think about that distinction. So if the shark in the water is a potential hazard, but the person is standing safely on the shore, so there's no exposure, so there's no risk therefore. It's only when the person goes into the water on the right here that there's a chance of there being some form of harm occurring. So we need to be thinking about this in the same way when we're thinking about the management of psychosocial hazards. You know, change, for example, organizational change, restructure is one of the biggest things we're seeing with a lot of organizations at the moment, a lot of change. Now that of course is a hazard, but is it necessarily a risk? And what is the level of risk if it's well managed, if it's well communicated? So we're starting to think there's hazards everywhere. I look out the window, there's loads of hazards out there, but it's really thinking about risk and assessing level of risk that we need to do if we're going to be doing this well. So it's really, really important to emphasize this throughout. So the hazard is the possibility of causing harm, but it's the exposure and then the probability of that harm occurring that we need to be thinking about. Now, it's a bit of a contentious area when we talk about the maturity of the topic of psychological health and safety, because some say that it's a new topic because it's not necessarily something that everyone's heard of when it comes to psychosocial risk management. But it's something that we can apply a lot of the lessons we know from physical health and safety to rapidly improve our maturity in this topic. There's certain areas of the world that are a lot more advanced in the measures that they implement, particularly Australia. So there's a lot we can do to draw knowledge and infer the best steps for us to take when it means managing psychological health and safety. So of course, just like with physical risks, we need to think about how we can eliminate the hazard. Now, it's not always viable to eliminate hazards altogether, but that's always going to be our first port of call when we're looking at management of any hazards, is just getting rid of them altogether. So in some way, removing the shark from the water, obviously not always viable. If not, we need to be implementing controls to optimize safety and thinking how we can protect against exposure or mitigate the impact of the exposure, which we're going to look at shortly. Consulting with the workers is absolutely fundamental throughout the entire process of management, as we'll go on to look at in a moment, but making sure that we're telling them of the risks and helping equip them with the skills to navigate those risks. So beware of the shark signs is a good place to start, and implementing control measures, again, in consultation with our workers. All of this we're going to look at in more detail. Design change will always be deflection. So actually looking at what measures we can implement to change the way work is designed is always better than trying to sort of deflect it away. We need to look at fundamentally how we can reduce the chance of risk occurring. And PPE, psychological PPE, you know, it's all about damage limitation. It's all about reducing the limit of exposure. It doesn't necessarily change the issue at root cause. So how can we do this well? So this is kind of the generic process we need to move through and to think about. So point one we have at the top at 12 o'clock is identifying what the actual hazards are. So what are your sharks in your workplaces? We then need to go on to actually assess the level of risk, particularly based on things like the duration, the frequency and the severity. All of this we're going to go into more detail. We then look at control measures. We look at nature of interventions and what options we have. And the review is really, really important. Central to all of this is leadership commitment and management training. We need to have an organisation that is committed to doing this and to doing this well. There's a lot of phrasing being used in the industry, particularly the last 18 months, I'd say, about well-being washing, about box ticking, about trying to do things at surface level and not going sort of to the deeper depths. And it's really starting to think how we can get that leadership buy-in to really demonstrate that this matters. But as I said, I firmly believe that management training is so important in this whole process, particularly with larger organizations, because it is really, really difficult to attribute this responsibility to, you know, HR, health and safety, occupational health. You know, it tends to sort of fall in certain categories or overlap between all of them, but we need to make sure that our people leading the individual teams understand this stuff inside out. And it's why I'm such a firm advocate for the countries that are progressing forward and mandating manager training in psychosocial risk management, because it to me is where we can really make that difference. But we need a top-down commitment, and we need managers to know what this means in their day-to-day roles with leading their teams. And then you have consultation throughout, you know, making sure that we're working with people within an organization to identify what the actual hazards are, rather than guessing, to ascertain the level of risk, again, based on exposure. I'm thinking about frequency, duration, and severity. Control measures, you know, sometimes the best ways to be asking what control measures need to be implemented is to ask people themselves and to involve them in that process, to make them feel engaged and that their input matters and their voice matters, because it's often the people on the ground that have got the best ideas around how to mitigate these risks, because they're living and breathing it every single day. And reviewing it, I cannot emphasize how many times I've worked with organizations and that bit's got missed, because, you know, we implement these things and think that that's sorted and that's fixed, but it's often the case that it falls short, it doesn't work, there's another change in the organization that affects the impact of that control measure. So we need to be constantly reviewing it, and it's more of a dynamic process than a lot of people realize. So it's really starting to make sure that these measures are working as we expected them to, and they're not falling short. There's not been a change that's affected the impact of those control measures, but it's a constant process that we're actually rolling through, and that we've got, you know, real embedded commitment across the organization. This isn't just landing on one person's shoulders to know how to manage. So we've done asbestos and sharks. I've now got another curveball for you in relation to starting to think about your organizational ecosystem. So as well as spending my time, a bit of time working in the asbestos industry, also a little interesting fact about me is I kept a very large marine aquarium for quite a few years. I thought it'd be quite a calming hobby to watch a scene like the one on the screen here, which I'm going to pause because I think it's making me gibber. You know, I thought it'd be quite nice. It looks quite picturesque, right? Quite calming. it's quite more involved as a hobby than I possibly anticipated, because it involves a lot of checks and being extremely proactive with keeping the tank healthy. And the reason I've included this as kind of like an analogy is because, you know, I know we hear this a lot, that if, you know, a fish gets sick in a fish bowl, then we don't, you know, blame the fish, we look at the environment. But the thing is with keeping a marine tank is things like the pH levels, things like the temperature, you have to be checking all of the time, because otherwise you could quickly have a problem with the health of the whole tank. But it's thinking about the role of every different team and person in your ecosystem, in your organization. So often when we think about psychosocial risk management and managing psychological health and safety, we look at like an organizational wide interventions, which can be really, really good, but it doesn't take into account all the intricate little mini micro ecosystems that are within our organization, which actually function very independently a lot of the time of the rest of the whole tank. So we need to be thinking about those different relationships. We need to think about those different environments that we have, and it's all about balance and making sure we're regularly checking on the balance and being aware of the different intricate needs and wants within our proverbial tank, if you like. So how do we do this? So we're not going to be measuring pH levels and temperature like I was with my tank, but what can we do to identify the hazards, first of all? So this is the top part of that cyclical model. We need to be making sure that we know what the actual hazards are. So thinking about job descriptions and work requirements, thinking how much clarity people have over their role, their job function, how it contributes to the team, to the wider organization. The last time that job descriptions were renewed is a real big one. We so often find that job roles evolve, they become more diluted. The restructures that I was talking about, big organizational changes, we find that people take on a bit of that job and a bit of this job and less of that job. And we don't always go back to thinking, do they have a real firm, specific job descriptions to their current role and what they're doing and what it entails, so they have complete clarity, so they're not exposed to any conflicting demands, but they know exactly what is required of them, and starting whether it matches their skills and their strengths, or whether it's just evolved to be a job that they now do because somebody else can't do it anymore, or because there's been a change externally. You know, often we have these things that just mushroom, but we don't actually look back and think, does this still match? Is it still right for this person, or has it just been right for the needs of the business? So making sure that those are regularly assessed and reviewed. Again, it's something that managers really should be involved in. Consulting with workers using things like surveys and focus groups, risk assessment tools, question surveys. These aren't the same as engagement surveys, which I'm going to go to in a moment. I'm quite a fan of focus groups. I'm quite a fan of, you know, bringing together lots of different people from different teams to share, you know, how they're finding their work, what would make their job easier, just to get it straight from them directly, as opposed to expecting them to, you know, go through Likert scales, as I found with my research and work-related stress. Now, how people just perceive certain words that we're using in these surveys can vary wildly. So it's really difficult, therefore, to draw parallels. But with things like focus groups and peer groups, we can just delve a bit deeper into what people mean when they use certain words. So I think it's a really, really powerful tool. Then you can do your thematic analysis with the key trends that start to emerge. Equally, I'm a big fan of manager peer working groups, peer groups to regularly come together and discuss pressure points, discuss how their teams are, discuss control measures, learn from each other. If you've got a very large organization, undoubtedly you've got managers who face similar challenges with their teams. So bringing them together to learn from each other and to learn what's working to help navigate those challenges, particularly if there's been big changes, can be really, really powerful. Also, if you've done any form of manager training, I'm a real fan of keeping the peer learner groups together to therefore come together regularly to talk about the content they learned and talk about the application, talk about how they're using the skills and the techniques they discovered, and it enables them to have this psychological safety. I told you it's related, it's not the same, but it's related, to talk about challenges that they might be facing as a manager, that things they're worried about with their teams, to make this something regular. Thinking back to my pH and temperature levels with my tank, we need to be checking these things regularly and making sure we have a dynamic process to do that. Of course, thinking about key indicators, thinking about organizational data, thinking about churn rate, thinking about retention, thinking about staff attraction, thinking about particularly whether you do not just leave interviews, but whether you like exit interviews or whether you do stay interviews as well. So any data that you have in relation to how people feel about working at the organization is really, really important. Observation, really, really powerful. It's something I actually used to do more of pre-COVID. I haven't really been doing as much since, but it's about going in and watching how people work. And this can be really, really quite telling. It's just watching in an open environment, in any work environment, how people are interacting, how they are working, how they are communicating, how often they get up from their desk. Just observing certain working practices and trends is really, really important. Looking at data sources, looking at trends, obviously in the industry, attending sessions like this, finding out what other organizations in your industry do, looking at coming together to find out, you know, how other companies are navigating and managing risks is really, really important, and learning from best practice. Making sure you have some form of anonymous reporting system is really important, and not just like an annual thing, but making sure that people can, you know, share if something is causing them distress, if something is affecting them adversely. It's really, really important that we have the capacity to tell people about that. And, you know, it's just making sure that people have that voice and that opportunity to have concerns that they can share, but also making sure that there's a two-way communication with that. So we're regularly giving feedback on any comments that have been made, and people don't feel that they're just throwing this comment into an empty vessel that's never going to get read. But making sure there is a form of anonymous reporting. Pulse surveys can be a really, really good way to have those little touch points. We don't want survey fatigue, of course, but just making sure we're regularly touching base and asking key questions that can really yield significant findings is really, really important. And manager one-to-ones. So encouraging managers to regularly check in and ask key questions. I worked on a project recently, and we encourage the managers to regularly get together with their staff and ask questions such as, if you were in my place, if you were the manager for the next 6 months and you had the option to provide any resource to improve well-being and to improve efficiency, what would you do? If you took over management of this team, what would you do? And we got some really interesting insight. It was really fascinating. So just regularly having those conversations. It doesn't just need to be, you know, how are you? How are you doing? How's your job? But asking more creative questions can be really, really powerful in getting more creative answers. And the stay and exit interviews I mentioned as well. Now, as I said, these surveys and this strategy is very different to engagement surveys. They've got a different intention and a different purpose. So trying to blur the two is kind of dangerous territory to go on. I understand why people do it because of survey fatigue. And it's like, well, we need to be asking people these questions, so let's also tie in these questions. But we're talking about risk. We're talking about managing psychological health and safety. We're talking about understanding hazards, but also the impact they are having on people. So we've got a very different intention, whereas engagement is about motivation. It's about connection. It's about satisfaction. You know, asking questions like, would you recommend this workplace to a friend to work at? You know, that's all about the connection they have with the organization. Really different to get under the hood of understanding hazards and level of risk. So I would be quite cautious with trying to combine the two, because the purpose is different, the intent is different, the follow-up is different. And we really need to understand, yes, hazard, but also the impact that hazard is or isn't having. So I would just avoid combining, because they are very different and the objective is very, very different. So what are the main hazards? So this diagram is probably one you've seen before. There's lots of different models around looking at the different psychosocial hazards. I quite like this one because it splits into organizational, social, and the environment. I'm fairly sure that there's none of those that would be a big surprise, essentially. Collectively, when we're looking at these different changes, us as an organization in the work that we do, the ones that we've seen being the highest is a demand and workload. So being too much work to do and not enough resource or capacity. Also conflict, huge spike in conflict in particularly customer facing roles, but also within organizations, things have become a lot more contentious. And I feel like, you know, things have become a lot more divisive. And although there's a lot more drive into inclusion and belonging, I feel like because of things that are happening across the world, which we'll go into in a moment, it is kind of having a ripple effect, particularly again in global organizations, and change fatigue. Just so much change that we've gone through, you know, globally as a society, but also in organizations is one that we're seeing quite a lot of as well. Really good question. Can you use the engagement survey to identify areas to follow up with a stress survey? Yeah, absolutely. I mean, you can use, they're connected. All these things are connected, but I would just use that to feel what questions you're going to be following up with the stress survey. So yeah, that's a really, really good way to do it. So you can make sure that you're pinpointing hotspots that are identified by the engagement survey to then tailor your stress survey. I'm a huge fan. This is the method that I adopt when I work with organizations, is to do the stress risk assessment by way of a survey, and then we do focus groups to follow up on the main stresses that were talked about to discuss control measures, because it enables us to say, you know, as an organization, these are the trends that we saw with the stress data. You know, what do you think would be the best way to manage this? So we're actually asking people what they think, and that's a really good way, again, to get more creative consultation with the workers themselves. And we can also therefore tailor it to think about high risk areas. So 2 recent projects, we had a particular department that was high risk, actually because it was customer facing, the point I was just making about conflict. But we also had another one that was in certain geographical regions. So what this did was enabled us to look at the stress data and think, okay, this is really where we need to focus and think about priorities, because these ones are really, really quite a concern in relation to the impact that it's having, because there was frequency that was high, there was duration that was high, and there was exposed, like the yes, the exposure was high. So the severity of the whole risk was quite significant. So it enabled us to work through a priority matrix with the organization to think we really need to target this area. So yes, they complement each other, and it informs and it shows that you listened in the engagement survey to then follow up and inform that to the stress survey. But I just wouldn't blend the two. So these are some of the most common hazards that we see. You probably have seen as well from the Health and Safety Executive with their management standards, a more simplified version of this, which I'll go to in a moment. But it's really starting to think what hazards could be prevalent. So starting to think, when we're doing these focus groups, we're doing these surveys, we're working with one-on-ones, we're doing the stay interviews and the exit interviews, we're gathering all this data. What is it signposting? Which of these would you highlight and say these are definite hazards that are being referenced? So then we need to go on to think about risk. As I said, hazard with the shark, there's only risk if there's exposure and the person's in the water. So we need to think about the whole web of risks and the relationship particularly between internal and external, because these are interconnected. So you might have certain hazards that are identified in the workplace, say change, say conflict, high demand, low resource, poor work-life balance. These are all things happening internally within the organization. But of course, as has become very, very profound with us all the last few years, there's other external factors, things like politics, things like social and economic factors, the recession, health crisis. You know, these are all connected, and it's all going to affect how people respond to the challenges they face in the workplace. This is why I lean on the analogy about the fish aquarium and the constant checks, because it's dynamic and constantly changing, and something that didn't pose a problem to someone 2 months ago may now cause them a problem. So we need to be regularly checking. So this diagram represents the 6 management standards as developed by the Health and Safety Executive in 2004, really looking at the key hazards that could prove to be a level of risk to workers if not managed effectively. And what's really, really important to be thinking about these is how they combine and how they interact together when we're thinking about level of risk. I always think about using kind of like a traffic light system of using the red, amber and the green. So red being the ones that we identify as being high risk. There's a hazard that we've identified and it has the probability of causing harm. The amber is perhaps with some groups and some not, perhaps it's a peak season that it's particularly problematic, but it's not a constant. So that's more your amber. And the green is the ones that we don't feel pose a risk at all. Now, the beauty of this, as we'll go on to look at, particularly with achieving balance, like I said, with the ecosystem and the tank, we need balance, is we can use the greens as kind of like a buffer against the red and the oranges. So it isn't something that all starts to connect and be too much. So for example, thinking about if demand is high, workload is high, resource is low, control is low. So say we've got those both are red, but we've got real clarity in our role. We understand our core function, our core purpose. We know exactly what our priority is in our day-to-day work, because you can't have multiple priorities. It's impossible. Relationships are good. I feel really, really supported. I feel that my manager is there for me. I feel that people around me I can talk to if I'm having a tough day, if I need some help. Any change that happens is communicated with me and I understand why it's happening. I feel supported and nurtured in my career. I get significant opportunities for growth. If all of those are okay, then that's going to reduce the impact and the level of risk associated with the demand and the control. But if we start to see support waning, if we start to see changes happening that aren't being well communicated, if the role starts to become more muddied and diluted, this is going to start to increase the level of risk that a person is exposed to. So it's really important to think about how they combine together, and whether these are all red, whether there's one red, because they all do interlock and they all do have an impact on each other. The other thing we need to be thinking about is different groups. And this is, again, where the manager's role is so crucial, because yes, there'll be some risks that are inherent across an organization. So there's one I'm working with right now that demand is high. No matter what team you are in, there is high risk of burnout, and that is across the board. But it's thinking particularly about different people in different teams and how those differences might actually impact the level of risk, because it's all about the person and the job match, and thinking about the impact that a risk has on a person and their profile. So for example, if you've got somebody who is a typical, anyone who knows about DISC profiling, a typical D profile, very fast paced, very task orientated, in a high performing, high pressure sales role, having a high workload is something they'll probably thrive on. There'll probably be a person that says they thrive under pressure. Change wouldn't necessarily be hugely problematic for them because they're used to working quite a fast pace and quite adjusting, but a lack of control and a lack of role clarity would be hugely problematic for that typical profile. So it's really starting to think about what could cause a problem for that person in that job role. It's all about assessing that. So this comes on to identifying the hazards and assessing risk. As I've said a few times, it's about the frequency of the exposure, the duration of the exposure, and the severity of that impact. So for example, we've got a huge project coming up. Everyone has to work 8-hour weeks, 1 month a year. So it's not really that frequent. The duration is limited. So therefore, the severity, yes, short-lived, but it's not really going to have that much of a profound impact. But if we started having to do 80-hour weeks every single week, the whole level of risk completely changes. As I said, customer-facing roles and conflict, huge spike, whether it's on the phone, front-facing, we've seen a huge increase in concerns in this area. So whereas before, people would say, sometimes they might get, if they're in a customer service role, an irate customer a couple of times a week. We've got low frequency, low duration, low severity, but because they're having to encounter this on a more regular basis, the level of risk is therefore increasing. So it's starting to think about how we can assess risk and therefore assess the priority of the control measures that we need to implement based on that level of exposure. So what control measures do we need to implement? This takes us on to interventions. So primary, secondary, and tertiary interventions is something that are often applied in different areas of health and safety. Traditionally, we've seen when it comes to well-being and psychological health, more of a focus on the tertiary interventions at the bottom, which is more of a reactive response. So it is once somebody is unwell because of their work, what we can do to support that and mitigate that and help get them back to work. So things like vocational rehabilitation, counselling, therapy, using EAP, this is equivalent of your psychological PPE. Secondary intervention is more awareness and education. It's support, it's signposting, it's tackling stigma, it's training on stress awareness and stress management. But the primary intervention and what we really need to be implementing if we're going to achieve what I said at the beginning and changing those stats and actually making a difference and improving the mental health of our workforces is proactive, is looking at those hazards, looking at what we can do to either eliminate them or reduce them or effectively manage them, looking at our work culture. That does include psychological safety, but it's what we can do to actually address the cause of ill health at source. So we're actually eliminating the chance of somebody becoming ill altogether. So the hierarchy of controls, again, is something that you've probably come across in other health and safety domains. But as I say, the manager involvement is throughout. I really, really believe that managers need to be equipped and understanding their role at every layer. So of course, at the top, eliminating the risk altogether, if possible, if practical. Next up is redesigning the work itself and the way that a person is working, making sure there's not a mismatch between the person and their job. Policy and process, thinking about expectation management, thinking about what policies there are to protect workers from situations. Education, of course, is that damage limitation, educating people how to manage stressors and recognize them, and then the PPE. But we need to be focusing the lion's share of our time and energy into eliminating this altogether. Now, of course, when we go into the ocean, there is a risk. Perfect prevention is not always possible. And like with the example with the customer-facing role, it's very unlikely that you would work in a customer-facing environment and not have to deal with a difficult customer sometimes. That is just the nature of that role. And if it's something that a person really does feel that uncomfortable with, despite all the measures that we can put in place, then we need to think that is there a mismatch there? But because we can't control the exposure to that irate customer, we need to think about what control measures that we can put in place. So, with our shark analogy, do we whop on a special shark protection suit? It's going to reduce the risk of that severity of injury. And there's still the exposure, but it will reduce the risk of that potentially get an arm bitten off. Do we look at putting some sort of netting in the water to protect and minimize that chance of exposure? But it's all thinking about the control measures that we can implement. So recent case I had with a customer service center is thinking, okay, we can't avoid the fact that there are difficult, irate, confrontational, unpleasant, rude people in this world, and the fact that in customer services you have to deal with them. But what can we do by way of job design to help reduce the risk of this causing ill health or harm? So it's something we worked with the customer service agents to do, and we talked about the fact that sometimes just chatting with somebody else who works on the phones as well over lunch and saying, I've had a really rough morning with it, that helps. Having the capacity to take breaks when they need them rather than have them stipulated was really, really important for them, so they could just down tools and get some fresh air. So inviting them to say, okay, when you have one of those days and you've had 3 of those type of calls, what helps alleviate the load, what helps it feel more manageable, and inviting them to implement control measures that they believe will help, and then revisiting, is it helping, is it working? I did exactly that, went back, and then the team was saying, yeah, I go to take a break and I feel bad because nobody else is. And it's thinking, okay, these all sound great hypothetically, but if they're not actually being carried out and conducted and actually lived and breathed, then obviously it's not going to work, is it? So it's starting to think about what measures are reasonably practical, that are going to make an impact and are in consultation with the worker themselves. Now, I've talked a few times about work design. I feel like the phrase is used quite a lot. So I just thought it's important to clarify what we mean here. So it is all about the characteristics, the many different characteristics of the job, and making sure, like I say, there's not a mismatch between the person and the work that they're doing. And just thinking about the way that jobs are designed, whether it's the most effective and efficient way possible. I'm quite a fan of using the SMART acronym. I don't know if you've come across this before, but thinking about whether work is stimulating for us, whether it does drive a sense of a personal growth and give us purpose. Mastery, do I feel that it's something that I'm learning and that enables my own growth, that I can get better at, that I can feel proud of myself, my own growth? So is my development something that's stimulated and encouraged? Agency, control, autonomy, is something that we can never underestimate how powerful that is for people to have a voice and a choice and to feel heard and to feel listened to. I cannot emphasize enough creating opportunities and groups coming together to talk about work, to talk about work pressures, to talk about ways they'd like to work is so important. And I know we can't change everything. I know that sometimes people say, I think we should do this. And you think, really not feasible, but let's talk about any other ideas that we've got. So we're making sure that people feel that there is this opportunity to voice that. And if they can't, or perhaps they don't feel comfortable doing that, we need to take that into account and think about things like the anonymous submission. Relational, thinking about connections, again, really, really important. You see a lot of pillars of well-being in organizations talk about social well-being and making sure that people do have that chance to connect and to collaborate. Another big trend that we have seen, particularly the last year and a half, I'd say year, is siloed working, is working in isolation. We're doing so many away days and team sessions at the moment about collaboration and coming together, particularly in a hybrid world, because, you know, when we feel that level of disconnect, it makes everything so much more difficult. We worked on a big project with a big social media platform, and their moderators did work pre-pandemic in, you know, big call centers, like with each other. They had a massive team of them, so they were seeing quite distressing content, but they were with each other. They had that social support. And then obviously we had lockdown and they were all working at home. A lot of them quite young, lived in quite small spaces with nobody else. And it was really quite distressing for them. And suddenly the impact, the level of risk associated with that hazard was amplified because they didn't have social support. And tolerable demands, thinking about how regularly we're checking in with pressure points and people's limits, making sure that they can articulate limits and talk about if things are becoming too much is really important. And again, a good tool to help us to do that is I'm quite a fan of investigating this type of model with managers to help them coach employees to think about the demands being placed upon them. The pressures, thinking internally, but also externally, because they're interconnected. So, you know, what are people carrying on their proverbial shoulders? Those of you who've seen the stress bucket model, what's flooding in, and what are the taps on the side that's alleviating that load so they don't overflow, that it gets too much. So it's all about starting to explore, you know, what the pressure points, what the demands are, what's weighing down, but also what we need to do to balance that out. Now, there'll be certain things on the left we cannot change. Ideally, we want to be reducing and removing what we can, but if we can't, we need to be thinking about how we can increase support, increase role clarity, you know, really making sure that there's that balance, essentially. Back to our marine tank, and you do everything in balance. We've got an alternative SMART description. Yes, so when we're setting goals, we need to make sure that we've got sensible, measured, achievable, realistic, timely. So another SMART's a great acronym, clearly, for many reasons. But it's just making sure that we're helping managers help their people strike that balance. So the last bit, the bit that's often forgotten, as I said, with the cyclical process that we had earlier, is reviewing the control measures. So making sure that this is done really regularly. So having a regular format for reviewing control measures that we've implemented, and making sure that that is expedited if it's not doing anything, if we're still seeing the problems in relation to, say, absenteeism, presenteeism, turnover, in staff feedback, if we're still seeing problems there when it comes to people's health and attendance behaviours. If there's a change that's happening within the organisation or externally, we need to make sure that's not going to have an impact on our control measure. If there's any new risk that's been identified, if a risk has changed in one area in relation to a hazard, because as we said, they all combine. So it's more the cumulative effect. So we might have a control measure that suitably manages one hazard, but if suddenly one of the other hazards becomes higher risk, that's going to have a cumulative impact. So it might mean that control measure is no longer applicable or fit for purpose. If any kind of consultation with key stakeholders, with employees, suggests that a review is necessary, we need to look at this, or if an additional issue arises. So it has to be a fluid, dynamic process rather than a one and done. Once a year, we review psychosocial risks. There needs to be a process. And as I said, managers really need to be supported and helping to play their part in that. So regularly engaging and asking workforces, yes, we want to look at the problems, the hazards, but we want to invite them to come to the table with what they think the possible solutions are. So they feel part of it, they feel empowered, they feel that sense of autonomy. And we're probably going to get some really good ideas from them as well. Think about different groups, think about different workers and their different needs and wants. I often apply the word KNOW as an acronym. So the K is knowledge, the N is needs, the O is obstacles, and the W is wants. So thinking about specific teams and what knowledge we have about that team, how they like to work, and what their preferences are, what their style is. It could be working hours, how they communicate as a team, but what knowledge we have, what the needs of that team are. So what drives them, essentially, what they need from the organization, essentially, because it's often a lot more than just salary. The obstacles, what do they find difficult when it comes to doing the job that they're doing? And the last one, what do they want? What makes them happy? What makes them skip out of bed and say, yes, I'm going to work? What truly lights them up? So thinking about different groups and thinking about those different things. There are quick wins, role clarity. When I said about job descriptions and reviewing those and things, you know, it's going to be potentially a lot quicker for us to achieve than thinking about alleviating workload when we've got limited resource. But it's all about implement, then evaluate. We have to have that constant process of evaluating the control measures that we've done, then looking at the hazards, then assessing risk, then control measures, then so we're constantly going around rather than just sort of that's done. And it's really, really important. That's always with leadership commitment, manager intervention, and consultation with staff. Now, I know I've tried to cram a lot into this to give as much value as to you as possible. I know there's a lot of information, a lot of ideas and implementation, but if there is anything that you would like help and support with, we do offer a lot of training on a lot of different titles. We have 450 different training topics that we offer as standard, as well as customized programs. But a number of our courses are now accredited by the wonderful International Institute of Risk and Safety Management. So Boiling Point is our burnout prevention program. So this was a reflection of the cases of burnout that we're seeing within organizations. And this really looks at equipping managers with understanding the occupational risks, understanding this is an occupational phenomenon, and there are things that can be done to reduce the chance of burnout. So the whole thing around Boiling Point is helping managers understand the impact of burnout, how to recognize it and how to prevent it, and their role in that. CPR stands for creating positive relationships, again accredited. This is something that we have been introducing a lot of corporate organizations, but also a lot in the public sector. It's actually mandated for student paramedics in certain regions in the country to complete the CPR program on their placement at university before going into working at the ambulance service. And there's a number of different public sector organizations, such as the police, that we're rolling out CPR. So this is all about support, it's about respect, and it's about the damaging impact that poor working relationships can have on our mental state and how we can deal with those accordingly. So there's an employee version and a manager version. Ice and Fire is about leading through change. Again, a reflection of the amount of change we're seeing in organizations. This is all about equipping managers with the skills to navigate change effectively, to communicate change effectively as well. And then the last one, this is going to be the next one we submit for accreditation actually, is PRISM, which stands for Psychosocial Risk Identification, Surveillance and Management. So that this is basically our psychosocial risk program for managers and leaders to help them understand the role they play in managing psychosocial risks and doing that well. Again, I think you can see I'm a fan of an acronym here, but that is the most relevant programs that we have based on the content that I've walked you through today. So if you would like to book a chat with any of the team about anything I've covered, if you want me to reiterate or go through anything in a bit more detail, if you've got any questions about the programs I mentioned, if you'd like a brochure, you can scan this QR code or you can drop an email to the contact detail on the slide here. We work, as you've probably gathered, with UK domestic, international, global organisations, everything in between. As I said, we have standard trainings, but we also have customised programmes. So we do partner with organisations to help, because we know this isn't easy navigating this tough world that we're in, but we are here to help. So I've got just 6 minutes, I believe, Sue, for questions.
Thank you ever so much, Sadie, for an absolutely fantastic session. I've been absolutely glued to it backstage. So
you are kind.
Lots of fantastic information and advice. And I'm looking forward to seeing the PRISM course when you send it through to me. So somebody's asked, could the slides be shared? I would say yes. If you're a member of IIRSM, we will certainly put the recording of the presentation onto the Resource Hub so you can see that. That could be done later today, early tomorrow. Are there any other questions from anybody that's joined us this afternoon?
I've tried to pounce on them as I went along.
Yeah,
so.
you did fantastically well. Seeing them pop up.
You can tell training's in my blood.
Yeah, absolutely.
We worked out recently, I trained over 100,000 people, so I've got my stripes.
Oh, brilliant. Yeah, absolutely. Any questions, anything that you'd like to ask Sadie about the presentation or any of the topic areas that she's spoken on this afternoon? So Tony's asking, are you finding that a partial return to the office is helping?
To be honest, it's a good question, but because it's a change, it's typically how well it's communicated. And, you know, I find a lot of the time that people are just told they have to go back now a certain amount of days a week, and they don't necessarily have the buy-in, because they're like, well, why? I've done my job perfectly well back at home for this long. Why do I need to go back? And so it's not necessarily communicated as well what the benefits are. And a big part of it is choice and autonomy about what days and whether that benefits them. So it's not in consultation. So the best examples I've seen, if that weren't of asking what they would prefer as the days, whether they want to change the time of day because they don't want to perhaps travel in rush hour, but giving people that chance to offer their suggestions of how that could work. It definitely though has helped with the siloed working, and, you know, help people realize the benefit if they do actually like seeing their colleagues. And, you know, I have a hybrid job. I'm not always here in the office, but when I do, it's so much easier to communicate. And we've got Slack and email like everyone else, but sometimes it's just, you can't detract away from having an actual conversation. So it is helping with the collaboration and the social connection, but it's just how it's managed. Main difference between a stress survey and engagement survey, the questions being asked and the intention behind the questions. So really good template tool to use is the HSE management standards. Their questions, they're really clear on going through and essentially traffic lighting which are the problem areas. So looking at demand, looking at level of control and autonomy, looking at working relationships. I think it's standard questions of 35 questions, but they essentially explore the different hazards and potentially using a Likert scale to look at the level of risk posed. Whereas engagement is all about how motivated somebody is. The classic question with an engagement survey is, would you recommend this as a place to work to somebody else? Because it shows the relationship you have with the organization. But it's intention and the information you want to gain. And if you try and do both, you do not very well either. So it kind of dilutes the intention, and you don't know how to communicate to the people doing the survey what you want to get out. And you also can't communicate the behavior and actions off the back of that. So it just muddies the water. So I would do one, then the other, and use one to inform and then the other. But just trying to do the both merged is too different. But lovely comment from Alan and Tanya. Thank you very much for joining us today. I'm glad you found it useful.
It's really lovely to get instant feedback, isn't it? So people are saying
it is
informative, much appreciated. Any other questions before we finish for today? Seeing how quickly people can type, you see.
Things with Q&A, with Teams, you get the dancing dots and you can see if someone's typing. So it's so much better. But here it's like, is there a question? Is there's not?
Tony's a great comment from Tony. So, communication he's found is vital in a number of areas associated with safety.
Do you know what, Tony? My first degree was in communication, and I'm a fundamental believer that if we could nail communication within our workplaces, so much of this would be, you know, circumnavigated. Because communication, I don't think we get trained how to do it enough when we're little, like particularly listening. Like, we're not necessarily that good at it.
It's that active listening, isn't it, as well? Actually hearing what people are saying and not just sort of going through the motions of listening.
Yeah, absolutely. But two-way communication, you know, it does make a big difference. Thank you, Susan, as well. I've just seen your comment at the bottom there.
Oh, that's brilliant. Yeah. Okay, so I don't think there are any more questions come in, so I think we'll finish the webinar there. So thank you ever so much again, Sadie. It's obviously had an impact from those comments that we've been getting. Went through so much this afternoon. So like I just mentioned, the recording will be on the IIRSM Resource Hub later, and we look forward to seeing everybody again at another IIRSM webinar in the near future. So thanks ever so much. Thanks again, Sadie. Goodbye, everybody.
Thanks.
Bye.
Thanks, Sue. Bye.
Bye.
Bye.